You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Bermel.
Thank you for listening to American Medicine Today. I'm Kimberly Bermel, joined by Ethan Youker.
Glad to be here.
World-renowned orthopedic surgeon.
Hello.
Dr. Alfred Bonati.
And joining us in studio is Dr. Dennis Locks, a world-leading expert in regenerative medicine and using stem cell therapy for joint injuries and osteoarthritis, among other things.
That's a big word.
It is.
I have trouble with it.
Thanks for being here, Dr. Locks.
My pleasure. Thank you.
Now, a lot of people, we've covered stem cells pretty extensively on this show. And
it was always so taboo.
There was, a lot of stigma involved with it, especially. I think there's people still nowadays, 20-some years later plus, of stem cells being around and being used. There's still some people who think that
Aborted
comes from
fetuses.
Babies and things like that. Not at all the case, correct, Dr. Locks?
Well, you can get stem cells from babies, but what we do is we use adult cells, and the misperception is still there, and I have to explain it to a lot of patients. The Bush administration cut government funding, and it was basically around the embryonic issue, and everybody still thinks the Catholic Church is against stem cells, and they're not. They're against embryonic, but every year the Vatican has a stem cell conference that they put on, and so there is a lot of misconception regarding that.
Yeah. But in the case of what you do, you use stem cells, because we all have stem cells. Explain what they are for people who still don't even know what they are.
Well, stem cells are repair cells, and they can differentiate into other cell types. They're present in various places in your body, but for our purposes, there's really two main reservoirs that we can utilize to use them to treat, and that would be bone marrow or around your adipose tissue. In your bone marrow, you have to create new blood cells when they die, and so we need a source there, and we as humans have a tremendous capacity to grow outward, so you need stem cells to create new fat cells, so there's a tremendous reservoir in that area.
Why don't you tell us what type of things you treat with stem cells? Well, what type of problems?
I have had a very interesting, diverse practice. I was the first one doing it around here, and so I've kind of seen everything over the year, from just about every kind of sporting injury, from teenagers to 60-year-old Ironman, and just seen a lot of different types of injuries, professional athletes. But I would say that the average person is between 40 and 60, and they were athletic at one time and they want to get back and their joints are failing them.
Sure.
And so we are a source that can perhaps prevent them from having a knee replacement or a joint replacement surgery and keep them functional and athletic. And that's one source. And the other is we get patients who are older and they may not be candidates for medical reasons to have surgery, so we're kind of their last hope to try to keep them functional. So we have a very diverse amount of patients that we see. Okay.
Are there ever any would-be clientele that come in for stem cell therapy and they're not a candidate? Would anything be a preventative from that type of treatment?
Yes, there are people that have absolutely no cartilage and their joint is destroyed where their bone is. It's sort of like a brake pad, and when the pads are gone and you're metal on metal and
Sure.
it's destroyed, you can't fix that.
Okay.
And there are other medical conditions. If they have active cancer, you don't want to treat them. There are reasons that we don't treat people in certain circumstances. But the vast majority of people, when you look at them on a whole and you listen to them and what it is they want, and typically their goals are improved functional level or decreased pain, and so that you pay a lot of attention to.
Well, and how does, just explain the process,
Exactly.
because I don't understand the process because I'm not a doctor. But how does it work? I know you get the stem cells from the patient themselves.
Well, let me ask him one question here.
Sure.
I know that you are in the type of a recovery joint type of a program. like arthritic cases or people who has some problems with the knees or the shoulders. But I'm interested on something that we just said. How I know that we harvest some of the stem cells from the bone marrow, but are you treated patients, for example, with leukemia, trying to regenerate the bone marrow on people who have a leukemic problem, for example?
Well, I'm not, but that's a very interesting point because stem cells isn't new. When they were doing bone marrow transplants in the 60s, they didn't really understand what they were doing. They weren't transplanting cells. They were transplanting the stem cells.
Exactly.
But because there was raw tissue, you had to use immunosuppressive agents.
Yeah.
Now you can just simplify it down to just stem cells and use the person's own before you hit them with chemo, and then make it a lot easier for them. So we've just become more sophisticated.
Do you have any experience on it?
I'm not doing that. Okay. I'm strictly pretty much orthopedic.
Okay. Do you have any knowledge about regenerating or curing people with stem cells that they have leukemia?
I have a peripheral knowledge of what they're doing. They're a long way off on some of the things that they're working towards. They're very sophisticated right now in what they can do. They're infecting the stem cells with viruses to reprogram their DNA to attack target cancers and stuff. So there is really phenomenal things that are going on with the research, but we're a little bit away from making it an
agent that's going to cure it, yeah.
or reimbursable under our current guidelines.
Right.
Yeah, we need to get rid of Obamacare.
Well, Dr. Lux, back to what Ethan was saying. Why don't you kind of explain how it works?
How the whole process works and how someone's stem cells that you harvest can fix or, help an injury.
Okay, well, if there is two main reservoirs, and whether you're talking about bone marrow or adipose or, anything that's going to try to repair something, and there's a lot of other things from matrices, scaffolds, and growth factors. But stem cells do two real functions. You have to take them from somewhere they're not really doing much and put them in an area where there's something to repair, like, say, a knee joint. So you would harvest some in a simple local procedure, and then you process that to make it it's like drilling for oil. You get crude. Well, you want a higher pure product like gasoline, but I make jet fuel, so it's a better refinement technique.
Super premium.
That's correct. And then the stem cells are sophisticated. They're master regulatory cells. They control immunomodulatory processes and shut down inflammatory cytokine markers. And so they do a lot more than just build a new cell, like a new cartilage cell. They actually help control what's going on in the joint environment.
None of those words made any sense to me, by the way, but I'm sure Doc understood.
You asked me and I told you.
How many treatments of stem cells do you need to see results? And does it differ from patient to patient?
It does. I try to get people better with one. There are some people who need more. I lecture kind of nationally and internationally, and the Australians kind of believe you need 3. Okay. And my comment was, what if you get them better with 1? We don't care. Right. So there's a difference on that.
And people, do they regress? I think about other diseases, and you might try a therapy and you might gain steam, and all of a sudden the progression is lost. Do you see that with stem cells, or is it completely different? What they gain is what they keep?
That's an interesting question that a lot of people ask. Mm-hmm. And if you think about it as a stem cell can repair, and the nature of arthritis is it progresses with time. Mm-hmm. Well, if you can stop time, you bought yourself something valuable. But if you can reverse time and repair it, you've now made them younger, but you don't become younger forever. You're not bionic.
Right.
So what you do when you leave the office after the treatment, if you're running marathons or you're putting 100,000 miles on your tire, will have an effect.
It's going to wear down again.
And it just brings
of course.
something else to mind, because you talk about osteoarthritis, and I always thought arthritis couldn't be cured. How does that work? I mean, does it really get rid of the arthritis?
Well,
now you're in trouble.
Well, sorry, there's just questions that come to my mind.
I paid attention to Ethan, and I don't want to talk too. But it's a very interesting subject. We now know that there's a lot more than just wear and tear. There's local responses inside the joint, like rheumatoid arthritis, and so we're trying to approach it on many different levels. But the answer is, if you wait till your joint is falling apart, it's harder to fix. But I personally believe that this is going to move towards a mergence of preventative and regenerative, where you just start earlier and you don't end up with such bad body parts.
Wow. Well, unfortunately, we're out of time, because this is a subject we all love to talk about. Dr. Dennis Locks, world-leading expert in regenerative medicine and using stem cell therapy for joint injuries and osteoarthritis, among many other things.
It's the website, drlocks.com, correct?
That's correct. Thank you.
LOX, drlocks.com.
Perfect. Thank you so much for joining us in studio. We truly appreciate it.
Thank you.
Thanks, Doc.